This is Danny Moen with an overview and brief history of Singapore's health system. Singapore is a small, young, and very prosperous country in Southeast Asia. Singapore's single-party government aggressively manages behavior and politics and established the National Health Plan, which emphasizes personal responsibility, competition, and innovation. The system relies on multiple payers, where individuals contribute to mandatory medical savings accounts with support from government insurance and subsidies. There are multiple healthcare providers, public and private, driven by active competition, price transparency, and patient choice. And now for some history. Western medicine arrived in 1819 with Sir Stamford Raffles of the British East India Trading Company, shown on the bottom left. Over time, British colonial rule implemented a free healthcare framework similar to the NHS. However, in 1965, Singapore declared its independence, and by the early 1980s, the public healthcare model became unsustainable as those costs quadrupled. Then, in 1984, Minister for Health Goh Chok Tong, pictured in the bottom right, established the current system using the Medisave program, requiring everyone to save a portion of their income for their own healthcare expenses. The program was supplemented in 1990 with MediShield, low-cost government insurance, and the MediFund endowment in 1993 as a safety net for those who needed additional support.
For primary health issues, there are currently 5 diseases that's plaguing the Singapore population. The first one is myopia. Myopia is genetically, the Chinese are predisposed to myopia, so Chinese children spend hours in near-focus activities such as reading, craft work, playing computer games. So genetically, they are predisposed to myopia. The second one is colorectal cancer. Those who are 45 have a family history of colorectal cancer are at risk in Singapore. However, less than 10% of the colorectal cancer cases are due to inherited gene defect. The next disease is diabetes. In Singapore, 9% of the adult population has diabetes. Study of diabetes amongst the Chinese, Malays, and Indian have shown that the latter race have a higher incidence of the condition. Recently, international research found that 6 genes could trigger type 2 diabetes, so they are predisposed to being diabetic, type 2 diabetes, and nose cancer. Nose cancer mainly affects Chinese and to a lesser extent the Malays. So the way that they prevent it is avoid processed meat. And the last disease that plaguing Singapore is thalassemia. It's only about 5% of the population that carries this disease, or 1 out of 20 people that carries this disease. And the way that they're trying to prevent it is it cannot be prevented because it's genetically disposed. Next, I will be talking about the PES analysis for Singapore. PES stands for political factors, economic, social, cultural, and technological. For political, the country's health is run by the Ministry of Health. The Ministry of Health is responsible to make sure that all of Singaporeans receive health care. And they were able to do so by introducing various programs, which Singapore recently provide health insurance for all of its members in the country. And they were able to do it through MediShield Life. A universal basic health care insurance is mandatory for all citizens and permanent residents, provide lifelong protection against hospital bill. The second program they have was Medisave, a national medical savings scheme, help out-of-pocket payments for citizens. And the MediFund is the government safety net for needy Singaporeans who cannot cover out-of-pocket costs. And as for technology, the Ministry of Health was able to institute a program called Sandbox. Sandbox was created to identify and understand new health care innovations such as telemedicine, mobile medicine through the industry partnership. The program seeks to develop an appropriate regulatory approach to facilitate innovation while prioritizing patient safety and welfare.
There are 3 main regulatory entities within the Singapore health system. The first one is the Ministry of Health, also known as MOH. Then the Central Provident Fund, also known as CPF. And lastly, the Monetary Authority of Singapore, also known as MAS. The MOH oversees the provision and regulation of health services. Specifically, it is in charge of promoting health education and monitoring the accessibility and quality of the services. The MOH also allocates primary care providers or specialists, as well as the administration of required licenses for the healthcare establishments. The CPF is a comprehensive Social Security savings plan. It ensures that working citizens and permanent residents allocate funds to support themselves in their old age. Workers and employers are required to make monthly contributions to the employee's CPF account. Unlike other countries, this is not optional in Singapore. Lastly, the MAS is the Singapore Central Bank. It regulates the financial aspects of the insurance sector. This entity has full control of the Insurance Act, which mostly protects the interests of the policyholders. It also regulates activities of insurance companies such as the proper registration and licensing requirements. The Singapore health system embraces three major priority programs: the cutting-edge medical technology for evaluation, the well-established advanced treatments offered in a subsidized basis due to cost, and the significant improvement in current management capabilities of certain diseases. However, outside of the three national priorities, the philosophy of the Singapore's healthcare system consists of many different pillars. Firstly, the country is aimed to build up a healthy population with preventive care and to encourage healthy lifestyles. Secondly, open competition between hospitals, care groups, and individual providers is highly encouraged. They also publish market rates for health services, devices, and medications in many public forums. Lastly, the government has to keep the healthcare costs down by controlling the supply side of the healthcare services and providing heavy subsidies at public healthcare institutions. The health system funding from the consumer standpoint is divided into two major categories. The first category is the funding accounts, which are the contributions that we cover in prior slides that are mandated by the Central Provident Fund. And the second category is the different type of insurance. Let's talk about the funding accounts first. No healthcare services are free in Singapore. The consumer uses the funds on their MediSave accounts to pay for coverage for either private or government-sponsored insurance. If the consumer depletes the MediSave funds at any given point, then the government has a special fund called MediFund that kicks in within a well-defined set of restrictions. Now, let's talk about insurance plans. There are many private insurance plans open to the consumer. In addition, the government has two available plans: MediShield, which is a low-cost coverage for catastrophic health events, and also ElderShield, which is a coverage for the elderly. Remember that this is low cost, but still not free.
Singapore has universal coverage with various layers of protection. That includes MediShield Plan, MediSave, MediFund, and ElderFund. Integrated Shield plans are optional supplement to MediShield, and 68% of the population has coverage. The MediShield covers inpatient hospitalization for prolonged illnesses and expensive outpatient treatment like chemotherapy and radiotherapy. It also covers long-term medications, but it does not cover outpatient specialist care and prescription drugs. Integrated Shield covers pre- and post-hospitalization costs and emergency overseas treatment. The MediSave, on the other hand, covers all inpatient and outpatient charges that are approved treatment, including medications, but it does not cover tests done before the diagnosis is confirmed and emergency department cost. Another plan is MediFund, which covers community-based care for underprivileged children and elderly. The last plan is called ElderFund, which covers long-term care with disability elders.
Singapore's government acts more like a business than a traditional government. This structure is at the core of their very cost-effective healthcare system. Currently, Singapore has been able to keep their health costs below 5% of GDP and plan to continue this trend through 2025. Besides their subsidy programs, the government is fairly hands-off and prefers to allow competition in free markets to improve the healthcare system through laissez-faire economics. The Ministry of Health, which is very analytical, does interfere if they see trends of rising costs. One of Singapore's unique advantages when providing healthcare is their small size. They are roughly 35 times smaller than the state of Maryland. This eliminates the concern of treating rural citizens because they just don't exist. Not only on the macro level has Singapore been able to contain costs, they are also able to do so on the individual level, with average cost of healthcare spending coming out to $4,084 per person, and of that, the average person spends $1,273 in out-of-pocket healthcare costs per year. Similar to the United States, Singapore has similar licensing and regular compliance audits for all of their healthcare facilities. They also have almost identical licensing and approval processes for their healthcare workers as the United States. They also give clear guidelines and expect medical professionals to provide up-to-date care. What makes Singapore different from the United States is their business-like approach to healthcare. Similar to a business, the Ministry of Health sets up clear objectives of what they plan to focus on for the upcoming year based on analytical data. Then they promote their goals through communal events, social messaging, reports, etc., and one of the most consistent messaging systems I've seen for healthcare. Because of these initiatives, the Bloomberg Global Health Index ranks Singapore as first in Asia and fourth in the world as of 2017 for healthiest country. Similar to most Asian countries, Singapore is also concerned about their aging workforce in addition to their high smoking rate. While healthcare is universal, it can be safely assumed that their copay system implies that wealthier people have access to more and better healthcare. This also follows their nothing comes for free mentality. As of March of 2018, 29% of Singaporeans do not pay medical bills, however, due to their income level. Singapore prefers to create subsidy and copay limit programs to fight inequality. In general, children and elderly copayments are significantly less than the working population's copayments. The Ministry of Health collects and analyzes data to determine what programs they should implement for the following years. Singapore releases the primary care survey to better align with its citizens' demands. In the most recent survey, they have found that the demand for primary care has significantly increased as the population is increasing in age. Primary care is provided through polyclinics and private general practitioners. What is unique with Singapore is it's common to walk into a primary care facility and be seen the same day. There is also no requirement to return to the same provider, or you can even see several providers at once.
So some of the notable innovations are the system provides excellent quality of care while keeping costs low. It is ranked 6th in the world by the World Health Organization, and consumers report a high level of satisfaction. Their system is also a leading destination for foreigners seeking medical treatments, and they focus on providing long-term care for elderly population through expansion of new facilities. An agency was created known as the A-STAR agency that oversees 14 biomedical and physical sciences, such as genomics, bioengineering, nanotechnology, molecular and cell biology, along with extensive research on cancer therapies. It also promotes the transition of research into products, services, and new businesses. They built a complex of 7 buildings containing state-of-the-art research labs and the latest equipment to show their commitment to healthcare and biomedical research. And the building has over 20,000 scientists, researchers, technicians, and administrators.
The hallmark of Singapore's healthcare market has been strong government control and oversight. Demand and supply side controls encourage patients and providers to be judicious and cost-conscious in their use of healthcare services. There are areas of improvement for Singapore's healthcare system. using technology to improve productivity and the use of group purchasing to obtain better prices, strengthening primary healthcare networks by reorganizing services around primary care through service delivery reforms, transition of care between healthcare providers by increasing collaborations with partners within the community, and an aim for UHC reforms to improve equity and decrease exclusion to promote social justice. All of these things can address issues with cost, quality, access, and equity. Innovations and reforms to address cost, quality, access, and equity. To provide better protection against long-term care costs, the Ministry will launch CareShield Life in 2020 to replace ElderShield. This newer scheme has higher cash payouts and will increase over time. And there's no cap on payouts for as long as the policyholder remains severely disabled. CareShield Life will be mandatory for citizens and permanent residents born in or after 1980. In 2018, the Ministry launched the Licensing, Experimentation, and Adaptation Program, or LEAP, and this is a regulatory sandbox for identifying and understanding new healthcare innovations like telemedicine and mobile medicine. In late 2017, the Ministry of Health launched its Beyond Healthcare 2020 strategy to move more care to the community, encourage health promotion, and share value. The Ministry of Health will also be launching the Elder Fund in 2020 to provide discretionary assistance for severely disabled and needy citizens who require further help with their long-term care costs. In addition, the Ministry and public hospitals are working on a value-driven outcomes and inter- and intra-hospital benchmarking to minimize unnecessary variation and to encourage the adoption of best practices. The Ministry has also started 2 bundle payments to facilitate care transformation and reward efficiency. And it has implemented a pay-for-performance framework to reward the 3 public health clusters that do well on key priorities, such as reducing hospital-acquired infections, managing length of stay, and minimizing waiting time for specialist appointments.